Hi, everyone. Thank you so much to those who participated so freely and openly in discussion group 1. It was looking at what challenges you're facing when it comes to your advocacy in UHC, largely around integrating mental health into UHC. And people really not only shared their challenges, but also what were some strategies that they were trying to use to overcome it. So really, thank you so much. I have learned lots. So we started off, a pretty big one was that there wasn't data to advocate for investing in mental health services, particularly around promotion and prevention. Of the data that did exist in countries, that was usually related to pharmaceuticals, and so naturally the focus is on, when it comes to mental health investment cases, it then is about drug therapy. And it's not on what we know is needed when it comes to mental health for UHC, which is services that are broad. We're talking in schools, mental health care in schools. We're talking in communities. We're talking about talk therapies and protective workshops and things like that, and residential centers. These are all the components that we need in our society for mental health care. We also spoke about how even when the services are available, people might not take them up. And so what we can do about that, how do we advocate for people to use services? And someone shared in the group that it sounds strange, but they're grateful for COVID. In that, the only reason why was because it made people aware that they needed mental health support, particularly groups who weren't usually seeking mental health support, like healthcare workers. They were now more open to being able to access services. And what happened was, when one of the, let's say, nursing managers went to use mental health services, other people within her team or his team or their team would feel more comfortable to utilize services too. So that was really good. Ali, if we could go quickly to the next page about what some other challenges were facing people's UHC advocacy, and I'm kicking myself for not writing any bigger, and as you can see, I wear glasses, so it's difficult. Oh, there we go. Thank you. Yeah. We focus too much on the general population. There is erasure, and there needs to be more of a focus on vulnerable groups as well on minority groups, and they need to be particularly mentioned in our policies and in our UHC advocacy. Just a shout out over here that the WHO has a UHC companion, which highlights the variety of interventions beyond medications. It is not that well known, so we would strongly encourage you to check it out. You can just Google it, the WHO UHC companion. Next page over here, other challenges that were being faced were lack of mental health funding, implementation, lack of coordination, and just having a lack of a mental health strategy, program, coordinating person within our governments. And a lot of people spoke about the importance of starting at that community level, having people with lived experience at the forefront share their stories to get the community leaders on board, so that that can eventually bring about some change. They can go at a district level and eventually a national level, so that mental health is able to be more of a conversation and starting from the grassroots. Yeah, but thank you so much, everyone. I really learned lots, and we're doing such good work in terms of trying to overcome, I think, lots of challenges that exist when it comes to pushing forward the mental health agenda within UHC. So thank you so much.
Sorry about that. Excellent. Thank you so much, Shani. So maybe we can use a couple of minutes. I don't know if any of the participants of Shani's breakout discussions have any thoughts also that they want to add. Sally at the back has the roving mic, so she's happy to give the mic to you. Does anyone want to share something, share anything before we move on to the next discussion? No? Then I'll give the floor to the second breakout. Taha, please feel free to come in and say your piece. Yes, happy to do that.
So thank you. We had a very rich discussion. I hope my group enjoyed it as much as I did. So essentially, we talked about that how can we make a case for integrating mental health with other physical illnesses, or even beyond that, even beyond just healthcare. And we felt that there's a lot of potential, particularly when it comes to communicable diseases like HIV, TB, and that's already going on. And so to make a case of essentially connecting mental health with the treatment outcomes of these illnesses. So if we make a case that HIV outcomes and TB outcomes can improve, so then high priority diseases for the government, they can have a more greater incentive to invest in mental health. But another factor was that we have to also be careful that it doesn't get lost in the middle, because if we integrate it in other communicable diseases, then it may sort of lose its importance. And another important point raised by, I think, Mark was that a major issue is when it comes to mental health and connecting it to other treatment outcomes, is that often what happens is that I think that's on this page. Yeah. So often what happens is that the problem that happens is that an economic case sometimes cannot be made. And the thing is that the economic case for mental health is important, but also linking it to the economic case for other NCDs. So if we can say that by investing in mental health, we can decrease the incidence of, let's say, hypertension, diabetes. So the economic burden of those illnesses can also sort of be an important point when it comes to, like, beyond just, like, for every $1 investment, you get $4 in return. Beyond just that, like, even saying that alleviating other illnesses through mental health interventions can have a more greater economic benefit. In addition, another aspect was integrating mental health in primary healthcare, and a lot of countries have already been doing that. I think BRAC gave some excellent examples of the work they've been doing in Bangladesh around that. And also to link mental health to perhaps even violence, so domestic violence, but also in other violence-ridden states. We can even link it to perhaps, have to be very careful about it, but even national security outcomes, that if we don't invest in mental health, then it can lead to national security issues as well. So even going beyond the healthcare field. In addition, another key area of intervention is maternal and child health. So the mental health of mothers, and then the outcomes on the development outcomes of children. So that can be a very viable sort of area in which we can sort of invest in. The next page, yeah. Other aspects which our group mentioned was that looking at other cross-sectoral integration. So even, as I think the Ministry of Health representative stated, that looking at agriculture, looking at education, and especially when it comes to primary prevention, when it comes to preventing the onset of disease, so working with educational institutions, working with schools, training teachers, awareness sessions, life skills development. I think some people mentioned that like helping students better manage their stress to prevent the onset of mental illness. So that can also be an important area. And then lastly, some people also mentioned that training, task shifting, training community health workers in delivering these interventions, because integrating in vertical programs in which the economic cost will not be high, which can be a greater sort of incentive for governments. But the downside of that is that it can overburden the community health workers. So either have dedicated lay counselors for this aspect, or have strong referral mechanisms to ensure that the community health workers don't get overburdened by the onset of new responsibilities. So I think that's about it. We had a lot to cover. If anyone has anything else to add, please feel free to chip in. So thank you.
Thank you so much, Taha. And I think it's so important that we don't take a siloed approach to mental health advocacy as we move forward and understand the role that it plays in so many different diseases as well. Thank you for that. I am going to move very quickly on to the third breakout discussion. Pradeep, the floor is yours. We'd love to hear from your group. And if you need me to hold something, let me know.
Hi, everyone. Thank you, Ali, for the opportunity. So, actually, I summarized what we talked in both breakouts into one paper, which we discussed about. So, first of all, I would like to mention what we discussed. So, as a topic, what we discussed in our breakout is how can we bring the UHC to the community, especially people with lived experiences. How can we involve or engage in government policy decisions and in relation to bringing mental health into the universal health coverage. So we identified few challenges that we are not, here I am saying we as people with lived experiences and the organizations of people with lived experiences. So what are the challenges that people with lived experiences are not involved in policy decisions and policy discussions? There are few challenges, and how can we overcome those, and what will be the good examples of those? So we discussed about those three things. So we identified three challenges. First thing is traditional beliefs, and if we elaborate it with more stigma, one thing is some beliefs of coming with religion and or culturally people with mental health conditions are recognized as not same as others sometimes. And also the stigma, especially even the health sector, health practitioners, they also develop and spread the stigma against the people with mental health conditions. So stigma is one major issue. And also as organizations, so as people, they don't, the policymakers or bureaucracy don't recognize as people with capacity or with properly equipped to involve in engage in policy making, policy decisions. They don't recognize us. And also, third thing will be we have limited budget for organizational development or capacity building among lived experience experts. Right. Those are the challenges we identified. And actions would be, came from our discussion. First thing is being noticed, because we are not being noticed as a key stakeholder. So how we become be noticed. First thing is networking. As a group, as a network, we are much noticeable, much capable in influencing, especially the people with lived experience of mental illness as well as cross-disability movements. Other people with other disabilities, they have the organization. So as groups, we have common issues. So we could be networked. And as a network, we are more capable. We more noticeable. And second thing is get community engaged. Not just the ones experiencing the problems, but also the general public. They also experience. They may be their relatives having problems. Maybe as a community, we have some issues because mental health is not engaged, involved in government health budgets and policy. So third one is lobbying and advocacy. Lobbying and advocacy should be more planned. We should map our stakeholders would be. So there was a great discussion in the morning. How do we influence to the policymakers? So for that, networking and connecting with other organizations, and as a whole, we can ask for it. And also, when we bring UHC to the community, that is also one part of our discussion. So in engaging the already available resources like traditional healers, religious leaders, to provide or actively involved in service provision, which is less expensive, readily available, and if we can capacitate them, or if we can provide with proper knowledge and understanding about referral processes and basic psychological first aids and everything. So it will help in two ways. One is service provision is much easier, and stigma is going out, it's reduced. And we had very good examples from many countries. For example, Philippines is doing capacity building with the help of WHO, and Libya has involved, and many other countries, Libya, South Africa, some other countries, they have involved religious leaders and traditional healers in the mental health service provision process. And Libya has a good advocated for a budget for mental health, and there are many others. And from my example, my experience, we had a really great achievement in 2020. Previously, people diagnosed with mental health condition were not allowed to cast their vote, but in 2020, we could achieve that. People with mental health conditions are recognized as same as others for involuntary and unbiased vote. So it was, for this July, it has been 3 years now. So likewise, we have good examples around the world. So thank you very much. Thank you for your contribution to my breakout. Thank you.
We're coming towards the end of the session. I wanted to thank you guys so much for taking the time to come here and to share your thoughts. You've identified some challenges, you've provided some potential solutions to them. I want you guys to use the rest of this conference to really connect with each other, learn from each other, share resources, and just make some allies in the mental health advocacy space that you can use moving forward. A lot of you have some amazing track of work behind you. A lot of you have some great ideas. The session doesn't really end here. I feel like the conversations are just beginning. And I wouldn't be doing my job as co-chair well if I didn't mention the UHC working group of the Global Mental Health Action Network. I will be sharing a link after this with all of you amazing people, so you can join up. I want us to continue having these conversations every month, so I don't have to stop you this way. We have 300 plus members now from over 50 countries, but we don't have enough countries because we are still missing around 150 plus. So we need to get closer and closer to that number. You guys can help fill that up. And with that, I will bid you a lovely rest of the session. And yeah, please use the rest of the 3 minutes to just have a chat with each other, get to know each other better. Thank you so much. Have a lovely day. And thank you to everyone online. You guys are amazing.